large varicose vein.
Hello, everybody, and thank you for this opportunity. I just want to present our experience with this. I don't know, medical instrument or cultural instrument. The optimal treatment for large varicose veins remain controversial in the current literature. And this study aims to assess feasibility, safety, clinical outcome of microavulsion of large varicose veins performed using Drosh instrument. The study included patients who underwent intervention for the management of lower limb varicose veins and had large varicose veins. Large varicose veins, for the sake of the study, defined as a varicose veins more than 7 millimeters. Microavulsion was performed using Drosh instrument. Intravenous laser ablation was performed for all patients. And postoperatively, the limb was treated by bandaging for 5 days. The type of anesthesia we use is a multimodal analgesia. It's already published in another separate paper. What's a Drosh? This method. It's a special instrument. Culturally, in our culture, use it for shoe by cobblers or shoemakers. They are using this for suturing, repairing shoes. So one day I had the opportunity to, in the downtown in my city, I observed this shoemakers very easily using this instrument and blindly putting inside the shoes and taking out the thread. So I thought, why it's not used for vein? It's possible. I just had a chance to do training in the same place. This is a shoemaker, and this is me training on the shoes. But really, I was not skilled too much, obviously. Later on, I found that the instrument is somewhat sharp, so I manipulate the instrument in a special place that making the instrument somewhat blunt, not so sharp. So I tried. Before using the instrument, I used this kind of needle to make a punching in the skin for all cases, regardless of the size of the vein. So like this, the place of the vein already marked, but in this photo is not so clear. But already we marked in the standing position. So we try to take it out by the instrument. When we take it out, we'll catch by the mosquito and we'll continue on phlebectomy. So for the last 5 years using this instrument, I haven't sutured any kind of skin lesion puncture. I haven't sutured. So I don't know. I have time to continue on the video. So all kind of veins, the wall of the vein is very soft. So in most of the situation can be taken out from the micro puncture using the needle. One of the example, for example, this case is one of the 100 example of this microphlebectomy. The study included 270 patients, and majority of them were female as usual. They are young, and about 63 patients had bilateral lower limb varicose vein. There is a problem of enlargement of the hole during avulsion of the vein in minority of the patients, 6% also. All of them was managed by plaster, not by suturing. The amount of blood loss was roughly estimated to be between 5 cc to 100 cc. Postoperative hematoma causing pain at the site of the avulsion was observed in 6% also. And painless infiltrating skin hematoma was higher, but it was resolved within months.
We just did the meta-analysis comparing
Postoperative intervention, significant post-intervention paresthesia was also observed in 5%, and 2 patients had DVT. In my explanation, this was not related to the instruments, it was related to the intravenous laser ablation. And no infection was recorded in the study. So could be Drosh might be an acceptable alternative instrument for avulsing large varicose vein. And thank you.
General anesthesia.
Multimodal analgesia. It's a combination of analgesia and sedation.
You had IV in the patient.
Yeah.
Intravenous.
Yes, sedation without intubation.
Second, there's a comment. The hook that you're using looks like a crochet hook that we have seen in the United States that is used quite often. But every one of us has a different like in terms of hooks. So are you championing this hook, that this hook is better than another hook, or you're just demonstrating?
I don't say it is better than others, but in my personal experience, handling was easier, and it can be used for all sized veins. So it needs a comparative study to compare this instrument with the other instrument. I cannot say that really without the data.
Dr. Kakamad finished my question, that's why he kept on talking. But my question to you is, and he got caught with this concept of worrying about the hook, is it actually because you've got a bigger handle and it's to do with the way that you actually manipulate? Is it more with the manipulation and the handle? So what do you think is the key thing? Is it actually the hook or the handle that you're using in the handle?
Thank you for the question. Really, I found the hooks acceptable for me for both reasons. Even the tip is suitable for, as you saw it in the video, the showmakers was easily can take out the thread through this blind hole. So the tip is also suitable, and the handling is also suitable for hard work. You see the shoemaker, they are very hardworking, and they continuously from the morning till near the night, they are using this instrument, and they are comfortable with it. So I thought that if we use it, we might be also comfortable with that in comparison to the other hooks. Thank you.
Do you use also chemical anesthesia in order to
Actually, no. Frankly speaking, we don't use tumescent anesthesia. We just use multimodal analgesia. It's a special regimen developed by our great anesthesiologists. They are giving multimodal analgesia without intubating the patient, without significant amount of local anesthesia. Sometimes, very rarely, I use local anesthesia with it. The patient recover within few minutes after the procedure, and she's always very comfortable because they are giving one of the components is benzodiazepine, which induce amnesia and some happy feeling in the patient.